And when I got the scans, it confirmed exactly what I thought, right? It was just so obvious on the scans. But what I would say is a lot of scans do not match symptoms. So there's a famous study that was done by Boos et al. I think he was from the Netherlands. And they studied a load of adults without lower back pain. Sorry, some with and some without. Sorry, yeah, some with and some without.
Mm-hmm.
And they found that 76%, I think this was over 40-year-olds, might have been over 45, I can't remember. 76% of people with no lower back pain had bulging lumbar discs, right? And 96% who did have lower back pain had bulging lumbar discs. So the moral of that story is just because something comes up on a scan or a test doesn't mean that that's necessarily the cause of your pain. Because if 76% of middle-aged and old people have bulging discs, but yet they're not in pain, the question is, why aren't they in pain, right? And again, it might come back to what I said earlier, is that overall physiological load or overall allostatic load that they're under. Two people might have equally bulging discs in their lumbar spine, but one looks after their health and the other one doesn't. Which one do you think is going to be in pain? Almost certainly the one that doesn't look after their health, or they've got emotional trauma or, mental stress going on. So it's a bit more complex than often, a scan will tell you.
Yeah, absolutely. And a lot of the time, probably the same with you, with our experience, you can kind of pretty much guess that, that is what's going on. And sometimes people just want a label, don't they? When they're in that distraught pain, they want to know, that's what I've got. And it's that label. But a lot of the time, I'm not saying it doesn't matter what is going on with them. Of course it does. We want to get them out of pain. But I don't need, like you, we don't need scans to sort of treat them. And would I change anything that I'm doing anyway, knowing that they have it or they don't? It would be exactly the same treatment. So it would make no difference. But I think it's just that, people like to have that label. People like to know what's going on. And sometimes I kind of get it, because then they can direct their treatment and their focus a little bit more with more precision. But a lot of things out there now, I'm not sure depending on your practitioner and what they're doing, if they've got the skill set, the confidence, you don't necessarily need a scan to kind of treat someone. So I agree with you.
Yeah, something we learned in functional medicine was something called clinical correlation. Again, in functional medicine, we do lots of lab testing, stool, blood, urine, hair, etc., etc. And the first thing that was drummed into us, you don't treat a test result. You have to match the clinical symptoms of the client to the test, right? So again, don't want to go too far down this rabbit hole. PCR testing, right? Asymptomatic carriers. What a load of nonsense, right? Even if you believe viruses exist, which I don't, but that's another episode. But
yeah, that's another story.
What scans can do is just give the person and the practitioner reassurance that they're working on the right thing, potentially. But the other thing where they can be useful, there are situations where you get a scan, because it might be the situation where a tissue has completely gone and they do need surgery. That can be a situation where a scan would be useful. But you're right. I've lost count the amount of people that have come to me with bulging lumbar discs. That's probably the most common thing I've ever dealt with in the last 24 years. Do I need an MRI scan to help them? No, I don't. I simply don't. And if it came back and confirmed what I thought, I would do exactly the same as I would have done anyway. I think if you've got if you've got a good assessment criteria, I think it's very, very rare you really need to do a scan.
Yeah, I agree.
If this sparked something for you, there's a much deeper conversation in the full episode. You can watch it here on YouTube or on Spotify, or listen on Apple Podcasts. Like, subscribe, and stay connected for more.